The final recommendation for lowering blood pressure is actually the most important factor. It's losing weight. For individuals who are overweight or obese and have a high blood pressure, losing weight is the most effective thing they can do to lower blood pressure. There's two studies to discuss. One is in women, the other is in men. The study in women is available in PDF format in the resources section for this course. It was published in JAMA, Journal of the American Medical Association, which has a very high impact factor of 45.5. Published in July 2009, it was a prospective cohort study of over 80,000 women followed for 14 years. The investigators found that women with higher BMIs had a greater likelihood of developing high blood pressure in the follow-up period. We define a normal BMI as less than 25, between 20 and 25. The researchers found that even a normal BMI of 23 or 24 still caused a higher risk for developing high blood pressure than a BMI under 23. And as body weight increased into the overweight category, so did risk of high blood pressure, getting even greater when body weight got into obese category, with a significantly higher risk of high blood pressure compared to someone with a BMI less than 23. This is the study in men. It was published in the British Medical Journal, BMJ, which has a very high impact factor of 30.2. This study was published in September 1989. It was a retrospective analysis, including 964 men followed for 4 to 40 years. The researchers found, as was found in the study on women, that as BMI increased, the average systolic blood pressure also increased. Again, being in a normal weight but towards overweight, like 23 and 24, started to get participants into the high blood pressure range. Again, the ideal body weight in men, as for women, was the low end of the normal weight spectrum, a BMI of 20 to 23. When participants got into the overweight category, blood pressure rose even further. In the obese category, still further. And in extreme obesity, blood pressure was highest. You can use a BMI calculator if you know your height and weight, and you can Google BMI calculator to find a free one. If you have an elevated blood pressure and your BMI is 23 or greater, I do recommend weight loss to lower your BMI to less than 23. And if you want help with that, I recommend you take this course on Udemy on how to lose weight.